Dr. Nayyar, it's good to have you. Thanks
Thank
for
you.
taking the time to swing by. Before we get started, can you tell us a bit about you and about your role and what you do, and then we'll dive into a fun topic.
Thank you. First of all, thank you so much for having me on. I really appreciate it, and I admire the work at Intermountain very much.
Thank you.
I'm Dr. Geeta Nayyar. I am a rheumatologist by training, but I have spent most of my career in healthcare technology. Used to be the CMIO for AT&T. I now work for a MSO in South Florida as their Chief Healthcare and Innovation Officer.
Awesome.
So I lead our mobile strategy, our telemedicine strategy, and our patient and physician strategy, as well as all the other typical CMO stuff that a doc has to do for a doctor's organization.
Sure, and I think you have a wonderful perspective. I'm one of your Twitter fans.
Thank you.
And I love to read what you write about. One of the things I've noticed you are quite passionate about is the patient. And we talk about a connected patient nowadays. What is the definition of a connected patient for you? What do you see? How do you think about it?
Absolutely. No, great question. So first of all, I think we're all patients, right? And the right word now is actually consumer, right? We're all consumers of healthcare. We've all been sick, or someone in our family's been sick. Yeah. And you know, when we talk about the connected consumer, or the connected patient, it's really simple. The connected consumer, similar to our consumption of any sort of retail experience, banking experience, is a consumer that has a problem, looks for a solution, knows what they're buying, is able to shop around, is able to then purchase that service or product and reflect, figure out if that was a good service, a good product, if there's anything needed to augment that service or product, and decides to either come back to that experience or that, you know, producer of that product or service, and has a good experience. I mean, has a good experience. And too often the scenario I just laid out, it just doesn't exist in healthcare.
Why not?
Well, it's complicated, right? So, and in healthcare, we always seem to think that we're special. You know, we're so special because we're so regulated, and this is sensitive stuff. Yeah. I mean, if you look at any other industry that we could follow, I think it's really clear. The banking industry is a great example. The retail industry, increasingly also good experience, right? Hospitality industry.
Amazing.
Great experience. Go to the Ritz-Carlton, right?
Yes.
I mean, great experience. You want to go back.
Yes, you do.
Ask the patient, ask the consumer today, how many of them want to go back to the same hospital, let alone the same doctor's office. It's few and far between, right? And oftentimes they actually don't even know what they bought. They have no clue what they're supposed to do after they leave or when they're supposed to come back. And, you know, I think we just have to look at this in piecemeal and really divide the patient experience into before care in the healthcare, before care in the healthcare system has actually been delivered, the point of care, and then post-care. And so I feel really encouraged when I look at HIMSS, because I think there are people doing some really good pre-care stuff. There are some vendors out there and provider organizations doing some really great point of care stuff. And then there's folks that are really focused on the discharge aspect, the coordination of care aspect. But the key is to really tie it all together.
Yeah.
That's the key.
The big challenge too, right?
Absolutely.